invite for everybody. So Louise is a professor of nutrition and behaviour in psychology at Sheffield. I met Louise in her role as co-director as NAPIC when we were on a panel for the Bezos launch. And in that, the 5 minutes pre-panel chat and then the panel itself, I was like, really want to talk to Louise more, and I know a whole load of people who I think will be really interested to hear about her and her wider team's work. So Louise, thank you very much for making the time to come and speak to us this morning. Probably Fiona told you it's around sort of 20 minutes talk and 30 minutes total. We have a bit of wiggle room on that, but that's kind of the sort of rough timing. So over to you.
Okay, thank you very much, Fiona. Yes, delighted to be here. I'm the co-director of NAPIC, which I think people are familiar with, but I'm also the co-director of the Institute for Sustainable Food, which is a cross-university virtual institute in Sheffield, bringing people together across the whole range of anything related to food, from plant science to behaviour, and the co-director of this Co-Centre for Sustainable Food Systems, which is about, I think the raison d'etre there is it's a whole of Ireland project, an Anglo-Irish collaboration. And the idea that I'm going to draw on today in my kind of overview is how we help people transition to a healthy diet from sustainable sources. And I'm going to give some examples from our Transforming UK Food Systems programme grant on healthy soil, healthy food, healthy people, because that's coming to an end. So that's where we have some actual data and results. So without further ado, I shall try and see if I can move the slides forward. Nothing's happening. Let's just try. There we go. Next slide. I'll have to do it that way. These are my disclosures. And really, I don't think I need to tell people on this call about the need for alternative proteins, but I think we can basically put that into four kind of categories at the moment. One driver is sustainability. The other is the growing population, and therefore how we meet the nutritional needs of that massively expanding population. It's also because diet is probably the most important reason for non-communicable diseases and the health impact that these have, and therefore the cost that they have to health systems throughout the world, but particularly where it's a national health system like in the UK, and growing concern and improving standards of animal welfare. So what we've done as part of NAPIC, we're working towards a roadmap for a national protein strategy. And so our starting point has been to analyse the National Diet and Nutrition Survey, looking at where consumers get their protein from. And I've taken these selected food groups because if you show all the food groups, there's a lot of very, very small ones. And I think it's pretty clear here that it's cereals in the pale blue, meat in the dark blue, and milk and milk products in the orange colour. Vegetables and vegetable products and dishes are very, very small, and fish is very, very small. And when you look at the economic reasons for that, it's for the vegetables, it's definitely not about cost. For fish and fish products, it often is. So if we focus in then on the different kinds of proteins, so meat you see is absolutely dominant. Plant-based meat alternatives is here in green, and you can barely see them. So they are a tiny fraction of the market. Pulses and legumes, which we're kind of interested in my team, as a way of not only increasing protein quality, but also fibre. Those are also very small. So at the moment, we're looking at meat and fish as key areas, with lots of opportunity for legumes and plant-based analogues. If we look at animal versus plant-based milk and cream, which you think would be quite widely available, again, you see we're still very focused on animal-based dairy, very little market share for plant-based dairy, milks, creams, yogurts, and so on. And so if we focus in on asking people in the Food and Youth FSA survey, which we've been doing analysis of, the most latest wave went from October 23 to January 24. More than 50% have never heard of or never eaten meat analogues. Current consumers, it's about 27%, and we have lapsed consumers who are 22%. So this is a representative sample across the whole of the UK, with oversampling in England, in Wales and Northern Ireland, so that it is fully representative. So that's quite interesting already, that we've got 50% who don't know what it is. So if we look in detail then at the people who have never eaten on the right-hand side, we see that these are older adults, they're omnivores, they have lower household income, often households with children, and an overrepresentation of Northern Ireland there too, which is kind of interesting for me from my Irish co-centre sort of project. Current consumers tend to be adults, young to middle age. Vegan and vegetarians have higher household income and more predominant in England and Wales. And the lapsed consumers, the only thing we know about them is they are England and Wales and they're omnivores. How often do people eat those meat analogues? About a third are more than once a week, 43% once a week, 24% less often. And why do they say it? So we've broken this down into current consumers, and they're the classic reasons: environmental, health, the taste, and animal welfare reasons. If you look at the vegetarians and the vegans, they tend to cite most frequently that they don't eat meat, and these are an alternative, and animal welfare reasons, and also a little bit environmental reasons. And the omnivores and pescatarians give a whole range of reasons. So wanting a change gets added to those lists. Asking about food-related concerns and meat analogue consumption, the never-eatens are not concerned about animal welfare or food miles. The current consumers are eating them anyway, and the lapsed consumers are also less concerned about those two factors. But there's no association with nutrition or the use of hormones, steroids, or antibiotics in the food, or even food prices. So my view, looking at nutrition and behaviour and how we help people shift to a healthier diet from sustainable sources, is to look at consumer acceptance, because unless the consumers understand the product, trust the product, and like the product, they are not going to eat it. So the biggest barrier, in my view, is consumer acceptance. If they have a particular view of a product, if there is something that they don't like about it, they're not going to eat it. So if we look at acceptance to eat food containing alternative proteins or different sources of proteins, you see the things that people are used to, animal proteins, dairy proteins, and seafood proteins, are largely highly acceptable, as are plant proteins. But there's a lot more skepticism and a lot lower acceptance, or even unacceptability, of insects, single cell proteins, and in vitro proteins. And that's from a paper in 2022. So things might be shifting, but it does seem to be that we need a bit of a communication message here. So thinking about areas that the CARMA group are interested in as well, I think that some of the challenges relate to technology, scalability, economic viability, nutritional quality, and really palatability. How we address those then might be thinking about the consumer. It's getting the sensory qualities right, thinking about the sensory characteristics, that's both mouthfeel and smell, aroma. So an awful lot of taste is driven by smell and aroma, but mouthfeel is also really important. Safety is a key thing, having trust in the food. There's also an element of what we call food neophobia, so things that people are unfamiliar with, and think about some strategies to deal with that. So putting those products in familiar dishes may be a way of increasing acceptability rather than confronting people with things that they're not at all familiar with. Thinking about social norms, if the groups that you associate with don't consume those foods, you are less likely to try those foods. Cost is an issue for some. Anything that evokes any kind of feeling of disgust will also lead to food neophobia. And for some people that actually read labels, and we know they're the minority, thinking about nutritional quality and health impacts and uncertainty there is another. FSA recently surveyed CCP industry to think about regulation, and I thought this was actually quite interesting data on the kind of things companies felt able to report on. And I think this is way out of my comfort zone and much more in yours. They seem to be much more confident reporting on things that are to do with contamination and management of production. So contamination, cell culture infections, physical contaminations than they were about things to do with allergens, cross-contamination, and any of those sort of nutritional hazards. So that's quite interesting if companies are trying to grow products in a particular area using CCP. They seem to be good at the production part, less good at the things that consumers will be concerned about, nutritional and allergens. And I think we cannot get away from the UPF angst that is permeating the media at the moment. Thinking about the NOVA classification, but also the way that that is being, I would say, misused and miscommunicated to consumers. So people are now very worried about having something that is unprocessed, minimally processed, clean label, and not actually thinking about some of the massive debate around ultra processed foods and processing and why it's there and why it matters. So I think we've got a very, very big hill to climb there in demystifying this ultra processed debate in a fair way for consumers. And I think when you look at this production process, you can see if consumers were confronted with something like this, they really would have some UPF angst, because this is not, you know, boiling, roasting, baking that they're used to doing at home. This feels very high tech and probably for a lot of people very unnatural and scary. So I think it's about how we demystify some of those. And I would say those are some of the key challenges. What we know about from a behavioural science point of view is about message framing. That could be used to increase consumer acceptance, how you talk about these things. But I think education doesn't change behaviour. Information doesn't change behaviour. And that's really hard for me to say as a psychologist. It's taken me 30, 40 years to get to that point of view. And so really thinking about how we target food environments more than specific individuals might be a better way forward. So my view is slowly coming round to the view that if we can't change the choices that people make, let's change the food. And I think in an alternative protein landscape, that shouldn't be about removing meat entirely. It should be about developing a middle ground and thinking about how we can have a blended protein economy. When I say meat, I also mean seafood and any kind of animal-based proteins. So I wanted to show, just as an example to finish up, one of the things that we've done in Leeds University, where I used to work and some of the teams still do, working with the halls of residence. We worked with the chefs there. We were very interested in increasing fibre, but lentils as a way of doing that is also about using an alternative protein source. And they were selling 60 kilos of beef lasagna a week, which is quite a big amount. And so we've worked with them to replace 30% of the meat with lentils in two of their recipes, and also producing a wholly vegetarian bean and lentil bake. We did taste testing with staff and students, asking them about how tasty the dish was, and how much they liked it, and also their willingness to pay. And I think what you can see here is that that blended protein is a much more effective way. They were less keen, in fact, significantly less keen on the bean and lentil bake. It was still more than acceptable. If we were doing an appetite study, we would take anything that was rated at least a mean of 5 to be a test meal. So it's still acceptable, but pitted against a beef bolognese or a chicken curry, the beef bolognese was coming out on top. That's with the 30% lentils. Their enjoyment was higher for that meal as well. So we've actually managed to incorporate that into the university offer, and it's been on sale. The beef lasagna, we're using that beef bolognese, has been on sale in the Union since September, and we're monitoring closely the sales of that. So that's a kind of a health by stealth approach. And I think to take away, I would be saying that health by stealth reformulation into blended approaches, into familiar foods that people know and like, is a much more easy approach than trying to shift people entirely. I think it's really important that we make these dietary changes extremely easy. We want to make the desired behavior the easiest one to do. I think it's also about targeting environments. Mothers don't feed kids foods they don't like themselves. So those switches are not going to happen in the home. Those might be easier to happen if we work with key stakeholders and what I would call anchor institutions, schools, refectories, mass catering kind of opportunities. So thinking very much about how we make it easy for the consumer to try these things, to understand them, and to then like and trust them. And that, Mariana, was everything from me. I can stop sharing the screen. I hope I've rattled through it fairly quickly, but hopefully that's given people a bit of food for thought. And you can all tell me what you think.
Fantastic. Thank you, Louise. Really interesting to hear that all together. And I'm sure there will be questions. You won't be surprised that I've got some questions. But before I ask mine, I'm just going to see if anybody has any burning questions they would like to ask. But people are thinking. Okay, great. I'll start then. So this I think the making it easy and the reformulation is like really interesting to me, because something that frustrates me about our industry, and particularly with cultivated meat and the like, or the in vitro proteins, is that we always and pretty much only see images of burgers, sausages, and chicken nuggets. And I'm not a big fan of that, because for me that's associating a healthy alternative with unhealthy food. However, is there an argument that if you could have something that looks like a sausage that's formulated into a super healthy piece of meat combined with lentils or whatever, is that then an argument against the fact that I don't like just seeing burgers, sausages, and nuggets?
I agree with you. I see exactly where you're coming from, but that's also probably because I think we're unusual. We work on food. We think about the healthfulness of our diets. I'm sorry, but the world out there doesn't. You know, there's a reason why McDonald's sell 3.6 million meals a day. And if we want to reach those people, we have to put those healthy alternatives in foods that they're familiar with and that they're happy to eat. And we have to show that they're just as good from a taste, palatability, cost point of view in order for people to make the switch. And I'm almost saying, make the switch, but don't tell them, you know? That's part of it, I think, because once you've made that switch and you say, well, actually, did you know there was such and such in there? Or it's made in this particular way. Did you taste any different? If they say no, but that's actually healthier, as long as it's not more expensive, people may well stick with it. And I think one of the problems that you see in supermarkets is you'll have the veggie sausages next to the meat ones, and people will look at them and they'll make that price comparison and go, well, they're about the same price. Why would I buy the veggie ones when I can have meat ones for the same price? So understanding people's decision-making heuristics when they're making those comparisons is also an interesting and quite important thing to take into account. And then I would say, so if we can make bad food healthier, that's great.
Yeah.
But if we can also then incorporate those alternatives to make foods that we're familiar with healthier and more sustainable, then that's the other way of doing it. So that's why the beef lasagna is a good example. You know, obviously, if they've replaced 30% of the beef with lentils, they've cut their cost, but they've also improved their carbon footprint, and arguably they've improved the healthfulness of that meal.
Yeah.
So I think we've got to take it's not a one size fits all. It's which consumer group are you targeting? Which product group are you targeting? And how do you find what works best for whom under what circumstances?
Yeah, okay. So with the
It's
like say
never
with the
easy.
no, it's not at all. And this is why I was like, I could talk to you for hours about this. And just while we're waiting for other questions, with taking the example of the parents buying like food. So I know from actually from my company with my company hat on, our investors are major global protein producer, and they at one point they do white label work goods for Tesco's. At one point they had on the shelves a mint product that had in it some kind of plant protein. I think it might have been pea or something else, which didn't sell brilliantly. So have you got? I mean, I get you haven't got the
I've
data
heard
behind it,
about
but
this.
what sort? Yeah,
Yeah,
what
I've heard
causes
about this
that?
kind of thing before. I think sometimes it's the placement next to the thing that they would normally have, and they do that direct comparison. I think sometimes it's um, the sensory properties. So we're doing a lot of work in food banks and food pantries, and what we've found is really effective is actually going in their cafe, making this food and letting people try it. Because if you don't have a good, disposable income, you're not going to take risks on something that you
Yeah,
don't know.
yeah.
So, so that sort of install trying it kind of thing, or putting it into a situation where people can try it. Um, the way that you introduce food as well to children. So, if you try things in school, we've managed to get schools serving and eating, kids eating really high fiber brown bread. And you do that by manipulating the choice architecture. You take away the white bread. But if you just do that overnight and suddenly there's no white bread, you've got revolution on your hands. Remember Jamie Oliver and the burgers being pushed through the school gates, that kind of thing. Um, so doing it in a way that involves the consumer. So the way we've done it in schools is we've gone in and said, we've got these new products. We want you to try them. You're going to be the experimenter. You're going to be the rater. You're going to tell us. It's really important that you tell us your view of them. And you get them to rate them. In primary schools, we did sort of yuck, okay, and yummy. And they rated these breads, but they didn't compare them with white bread. They compared them with different kinds of high fiber bread. And then the following week, we start introducing those breads, take the white away. But you liked that last week. You said that was the best one. So we're going to serve you it this week. Isn't that fantastic? And we've had a whole school in Liverpool eating that bread for a year. And guess what? Attendance went up. Yeah. Amazingly so, because you're giving them a breakfast that they actually have chosen. And I think Jeff Brunstrom in Bristol has done a really nice study, again, manipulating those dietary choices. So he's worked with the Hall of Residence where they do catered food and manipulated the menu. So they can still choose pizza and chips or fish and chips, but not every day. So on one day, you're making a choice between the two less desirable things. And on the other days, you're making a choice between more healthy things. And that project's called Sneak. It's quite clever, I think, the way
Do
that
the
they've.
students complain?
No,
At
no, because they
all?
feel like they've had their choices met.
Okay.
Because
Okay.
at some point over the week, they've had their opportunity to have pizza or fish and chips or whatever. Yeah. So it's about manipulating the choice architecture as well. And I think that we're not doing that as effectively in supermarkets and retail environments as we could be doing. I do remember a drinks company once visiting me and saying that if they got a supermarket to take their entire range of their fizzy drinks, they sold more of the orange ones. And they couldn't explain why, but if they just put the orange ones in there, they didn't sell as many. And it's that comparison that consumers naturally make when confronted with a lot of information. So I think there's work to be done still on that decision-making heuristic. But I think, mothers won't feed kids foods they don't like themselves. Yeah, they don't want to cook it. They don't want to eat the leftovers. Um, And so the children don't get exposure. So we have to think about where can we work to bring those foods into kind of common exposure? How can we break down some of that? And Sam Caton, who's part of the H3 project in Sheffield, she's done lots of work showing that you actually need to expose a child 10 times to a food to make it acceptable. Whereas if you look at parent-child interactions, as soon as that child goes, "Bleh," yeah, the parent goes, oh, he doesn't like it, and that's end of. Repeated attempts are required, and they reckon about 10. And Sam did a study where the children cried at the end when they couldn't have any more Jerusalem artichokes. Yeah. And they had never seen a Jerusalem artichoke before they did that study.
Yeah, that is fascinating. Wow.
Yeah. Yeah. So I think, you know, we've got to, and it's not behavioral manipulation. I think it's understanding people's approach to food. And it's extremely emotional, isn't it? You know, we've all got preconceptions. I didn't think I liked spinach till I was 35, and then I realised it's just that my mother boiled it to death. And actually, it's quite nice, really. You know, so, but it's only when you overcome break down some of those barriers.
Yeah,
I get the feeling I'm waffling on at you all now. I don't want to.
No, it's really it is fascinating. Like I said, we've got some wiggle room, and I do want to just see if anybody from the floor has any questions for you. Before I'm going to ask one closing question to you, so I don't remember to do that. But any questions from the floor? So, Joanna.
Yeah. Sorry.
Hi everyone. Hi Louise, thanks for the talk. Picking up on the Liverpool school bread trial for a year, did you do any follow-up on that, or this is just very recently?
It's published. We published a special issue of the Royal Society. Yeah, I've even got it. Look, here you go.
Okay.
And the paper in that is called, I wanted to call it Children Are Not the Problem. And they made me tone it down. So it's called Children May Not Be the Problem.
Okay.
And that kind of explains all the taste tests that we did. But I didn't talk about that here because that's about fibre. And really, I thought we should focus on protein, but I think the principle is the same.
Yeah, exactly. No, yeah. I just wanted to know, like, if after 1 year of you guys giving that sort of choice of bread, did you make sure that the school could keep on going since the kids were happy with the results?
I would like to think that the school kept on going. What we found was, they were a school in a very deprived area, and they didn't have a free breakfast club. They didn't have any support for their breakfast club, so they were doing it themselves on a wing and a prayer with the cheapest possible things. So we went in with our donations of bread, but we also went back at the end, and the researchers spent 3 days filling in all the application forms that they would need to do but had never got round to in order to apply for National School Breakfast Fund program funding and so on. So they now have a program in place. It would be interesting to go back and see if they're now serving white bread again, but I would hope not, because they've also seen the benefits, because the children, if they have a higher fibre bread, are fuller for longer. They don't snack as much, and more of the kids were going to the breakfast club. And I think that's part of the ethos of the new National School Breakfast Programme that the government is supporting. I think it's also about childcare, but, you know, hopefully we can also deliver better nutrition at the same time. So yeah, very keen on promoting. It is an opportunity to give good quality food to children. And I think if I go back to the ultra processed food thing, one of the things that scares me a lot is people going down that single ingredient route, especially for things like breakfast cereal, because children get 20 to 25% of their RNA micronutrients from fortified breakfast cereals. And if you take those fortificants away and have your Marks and Spencer single cornflake ingredient, where are they going to get their folate and all their other micronutrients? So, you know, again, it's in breakfast cereal, it's health by stealth. They're getting those micronutrients. And I'm a big fan of that because I don't know where they would get them otherwise.
Yeah, that's a whole other conversation. That's so Efsan, do you want to ask a question?
Hi, thank you so much, Louise, for your interesting talk. So my question is a general question. So these days we can hear from different type of diet, keto, vegan, vegetarian. do you suggest to completely remove the carbohydrate from the diet and substitute with the protein, or no? What percent should be protein and what percent should be healthy carbohydrates such as the brown bread and etc.? This is my first question.
Let me first say, I'm not a dietitian, I'm not a nutritionist, okay? So I'm a psychologist, so I tend to try to not give nutritional advice simply because I don't feel qualified. But what I would say, based on evidence that we know from appetite research, is that most humans will regulate their protein intake fairly tightly. So about 20% of their calories from protein. And if you think about things like the Atkins diet, where we pushed people to eat 40% protein, people were not able to stick to that diet because protein is very satiating. So it was very hard for them to maintain a high protein level. So what you find is when people freely eat, they will take around 20% protein quite naturally, and they find it hard to take more. What varies then is fat and carbohydrate. And that's where we perhaps need to think about what the ratio should be. And there's been, I think nutrition is like other areas of science. Things are sexy and interesting and, of the moment. For years, fat was really bad and everybody was trying to eat a low-fat diet. Now sugar is evil and everybody is trying to eat low carbohydrate sugar. Yeah, actually, it's about balance. And I would say everything in moderation and nothing to excess. And that also applies to things like alcohol, because if you take alcohol, you have to metabolize that first, which is why alcohol makes you fat, because it's the other food that you eat afterwards that makes you fat, not the alcohol. But the fact that you've had the alcohol means you have to metabolize that first. So we are quite tightly regulated on our ability to consume protein. We can't, high protein is difficult to maintain and not necessarily good. It's about eating in balance. Most people eat everything to excess because
Thank you
it's
so much.
easy to overeat. We call it passive overconsumption. Very difficult to undereat because you have all kinds of drivers that kick in that say, hey, I need feeding.
Thanks. My second question is about the regulation. So one side of the story is that to change the culture of the people to consume maybe better protein and reduce the consuming of the processed food. But I think the government also are responsible. So we can see the shelves of the processed food and ultra processed food in Tesco, in Aldi, everywhere. So do you think in near future we can change the rule or put a strict law for the
I think
reducing?
we have to be really careful talking about ultra processed food because there is a reason for processing, which you guys know better than me, and it's often about food safety, shelf life. Nobody wants a loaf of bread that's moldy tomorrow. Yeah, if we took away all of those kind of things, we would have a lot of backlash and we would have a lot of waste. And also some food safety scares, I think. So there's a reason for processing. I don't think, and I think that the overuse of the classification of ultra processed food is quite problematic. And unfortunately, the consumers now have leapt on that and they think that's really bad. So we need to think about how we message around that. And I think what you're saying is don't let people put those things on the shelf. I think with alternative proteins, processing is necessary for virtually all proteins there's very few that we eat in a raw form. So processing is almost definitely necessary. I think what we have to do is build consumer trust, and that's about safety. And until those people are convinced that the food is safe, they won't go near it. I think we did a really bad job with GM. The communication around GM, it still comes up in the Food and News survey. People are scared of GM. If you talk about gene editing, they think it's the same thing. They don't understand the refinement of different terms. They see it all as one big bucket. And we can, if I give an example of like Nestle and baby milk, I think everybody remembers the Nestle baby milk scandal. It was 50 years ago. People have very long memories. And so we need to be so careful in how we communicate in the future about these different kinds of proteins, and in order to build consumer trust. And we cannot let something go wrong, because if one thing goes wrong, it will decimate the whole industry, because people will generalize. So I think we have to work very carefully and closely with regulators, and to understand at the same time, with every message we put out, we need to test drive it to see how it will be understood.
Thank you so much.
Thank you. Jonathan, one question from you, and then I'm going to follow up with a final question to close.
Hi, Louise. Thank you very
Hi,
much for
Johnny.
your talk. Really great to hear as ever. So I agree with the framing around public procurement and the need to think about how you get these kinds of foods into people's diets. I was interested in thinking about that in the context of the UK. So compared to a lot of countries, we have quite a kind of weak public sector provisioning system. And it seems like, councils hit by, a decade and a half or whatever of austerity can't deliver on that. So they end up outsourcing contracts to suppliers who work on very, very restricted budgets for individual meals. So compared to something like France or other kind of European countries which have much stronger public sector provisioning, do you think that that kind of really needs to be a part of a kind of broader governmental strategy? So obviously you talk about school breakfast and some brilliant moves on that front. The other side of that would be saying, an institution like the NHS has been much, much slower, to say the least. So do you think, DEFRA's new food strategy in preparation needs to push public procurement much more centrally alongside those smaller
It's
shifts?
interesting, and I know politically, Johnny, you and I have similar views on this kind of thing, but we're coming from a free market, we've had many decades now of that. So having state intervention is really difficult in that area, but also changing something like a procurement contract for an NHS trust is like turning a tanker around. They sign up to these things for 5 years. And hospital food is frankly vile, yeah? And I don't think there's much nutrition in it either, so there's a lot we could do with that, and I think we should. But I guess the devil is in the detail. It's in the how. How would you do it when you have this behemoth to deal with? If we could do that, that there is such poor food in hospitals that we're probably making people go in and come out malnourished. They go out worse than they went in because the food is so bad, and partly because they're ill and they can't eat it and all of those kind of things. But the same is true of schools. School kitchens, very few schools have their own kitchens anymore. And I learned that in Northern Ireland they have the school kitchens are not owned by the schools. So if the Breakfast Club wants to use it, it has to rent it. But if the Breakfast Club loses them a hygiene star, game over. People will pull their parents out of school meals. So there's all sorts of catch-22s and unintended consequences of making changes in that system. But I agree with you. I think it needs a massive overhaul, but it's how you do that. And how you do that against that market economy, tendering lowest price always wins kind of ethos that we've been brought up with in the last 2 decades. So, there is a lot to be said for some of the Scandinavian models where they don't think about lowest price, they think about best quality. But they also invest a lot in it. And you're in a catch-22. So I'm sorry, I don't have a clear answer. I can see what would be ideal, and that would be locally produced, healthy procured food delivered in a in an appealing way to everybody in whatever anchor institution they happen to find themselves in. But I think the practicalities of achieving that need real kind of systemic investigation and implementation, and it will cost a lot up front to do something like that. And I think there we have all sorts of other competing factors that might mean that that doesn't happen. So we need to look at what's happening, where are good examples locally that can be extrapolated into other environments or other communities, other areas, other LEAs, that kind of thing. And even with LEAs, you know, a lot of schools now are not bound to LEAs. So we're going to try and have school food standards. It's been announced that there will be a school food review. It will tell us things we already know, I think, but hopefully it will tell us something about how to change that. But while those schools are effectively independent of the LEA, you can encourage, but you cannot prescribe.
It's a big, complex challenge across the UK. I'm going to ask one final question, Louise, and thank you all for your questions and Louise, for your answers. Like I said, not surprisingly, this is, you know, the beginning, I think, of many other conversations. So you mentioned at the beginning that NAPIC is looking at the roadmap for the National Protein Strategy. So either from a CARMA perspective, given that we've got both wet lab and social science work packages, or from an individual basis as researchers, what would be the one thing that springs to mind that we can do to help with this really complex challenge of looking at moving alternative proteins into the normal diet?
Making alternative proteins mainstream is what we keep saying in NAPIC. I think it's about working together. I think it's about having consistent, very clear messaging. And that matters a lot and I think we can think about, especially with NAPIC and CARMA, how we can work together. What I will do is I'll plug the NAPIC collaborative funding, which opened this week. And closes on the, I think, don't quote me, but 17th of April or thereabouts, 17th, 19th of April. So I would really encourage you to put in bids and to think about, and I think the important thing here that CARMA has, that also NAPIC has, is that interdisciplinary approach. So it's not just thinking about, oh, we're going to make this and we can put it in food and then people will buy it. It's also about thinking about how we communicate with people in order to make that stuff safe, tasty, trusted, and also elevating both the sustainability message and the health message, and trying to shift, you know, the public perception. So I think it's really difficult, but I think it's really clear from a UKRI point of view that they feel they've made good investments in this area and they will continue to do so, I think, because it's so necessary that we reduce that reliance. We won't remove meat and dairy from the British diet, I don't think, ever, but we can change the balance, and we need to change the balance in a way that is healthy, that's going to have some impact, because we overconsume those things at the moment.
Yeah.
And there's also, I think there's also an argument from a local, as in national food security. If you read the press at the moment, you know, we're really worried about World War III and, you know, national security and our place in Europe and all of those kind of things, the things that are going on. But there's something to be said. Tim Lang's report about our preparedness was really sobering reading, because we're not prepared in this country, not at all. I won't even ask who's got a torch, you know, and some candles for when we have no fuel. But it's those kind of things. It's about trying to place food, I think, from a government point of view, in a context of national security as well as in a context of health. And I think we need to have a very united front to do that across all of the initiatives that are going on.
Yeah, yeah. Thank you. Yeah, thank you. I think, and actually, we've got the memorandum of understanding across these big centres. So we really need to make sure that we are using that to the advantage, basically, of the taxpayers who are funding all of our work.
Absolutely. And I think it's about coming together and looking at the synergies that we can produce and building some, you know, other collaborations out of that. So maybe we should have a CARMA NAPIC workshop at some point where we bring people together. That might be quite good.
Yep, I think that is, a very, very good idea. And I'm pretty sure Anwar would be keen to do that as well. So brilliant. Sure. We are over our time, but I'm hoping that everybody enjoyed that. I let it run over because I think this is so critical to what we're doing. And I hope everybody has enjoyed the conversation. Looking forward, Louise, to seeing more of you and having further conversations with you and your colleagues in the future. And again, thank you very much for your time.
Thank you, everyone. Really enjoyed it. I was quite nervous this morning talking to all these experts, but I didn't feel like the expert. So thank you all very much.
You absolutely are. Thank you. All right.
Bye-bye. See you hopefully very soon, folks.
Yes, indeed.
Bye.
Bye.
Thank you.